Hello, it's Bill, the Knee Pain Guru. Today is Monday, September 9th, 2024.
Hello?
Nina, anything? I know you had a couple of appointments this morning.
Yeah. It's been interesting that I've had this pattern of women of childbearing age having UTIs and also interstitial cystitis, which is like a chronic inflammation in the bladder. And this one has had a few UTIs, but now since her second child, she's having like chronic ones like over and over. And I'm thinking, well, I can do this homeopathically, but I bet there's some kind of pelvic imbalance that's going on too, because, it's not just the hormonal stuff, like childbirth is a very traumatic event for a woman's body and things can easily get out of balance. And then that other client that I had this past weekend that had the chronic UTIs, but had clear pelvis imbalance issues when you saw her. So
Mhm. Okay, so we have the bladder and the urinary infection is going to be in the bladder.
we seem to be just dealing with bladder and not necessarily like kidney involvement, but there does seem to be some inflammation in the whole pelvic region.
Okay, so with the pelvis, I'm looking at it from a lymphatic system perspective. When the pelvis is not balanced, then there's more of a tendency for the lymphatic system not to be able to flush out what's going on. So, working with modules 22 and 23, as
Okay.
well as 9, 10, and 11 to free up and balance the pelvis. So, this is just the organs. So, the pelvic bone would be blocking our view on this side, closer to us as we're looking at it. So, this is a cross section view. The next thing I'd look at is the Chapman's points. So that's going to be right around the belly button, as well as, well, you have Chapman's points for the urethra, which is going to be on either side. Now, these are the points on the front. So we're looking at this point right here and these points right here for the bladder on the front. And I'd venture to say that some of this will resolve just by balancing the pelvis. And then you can go and work with module 45 in the pain pattern interrupt section on these areas. And I would do all of these. So these are going to work with the ovaries, the bladder, and the urethra right here. Okay.
Yes.
And that's going to be on the front. And then on the back, this is going to be right around below the floating ribs
Hmm.
in the back. So we're looking at the bladder points in the back. And then if you try to reach those and stimulate those, like working with module 45, or you can use the old osteopathic perspective, which is just like stimulate to for 6 to 7 seconds, like a light massage. Not that you're causing a lot of pain in that area, but you're just kind of rubbing it to dissipate the sensitivity for 6 to 7 seconds. If you aren't able to reach those, you could use like a tennis ball gently against a wall if you have difficulty reaching those areas. That would be what I would work on in addition to the bladder balancing.
Yeah, it's interesting that the two main cases that I'm thinking about, one of them, the bladder infections or what seems to be like an interstitial cystitis, which is like a chronic inflammation that's not doesn't respond to antibiotics.
Mm-hmm.
She just had a baby number two, and they started in a chronic way after baby number two. And then the other one is postmenopause,
Mm-hmm.
and they started through menopause and right after.
Mm-hmm.
And I'm thinking, okay, like two major hormonal shifts and, like emotional, like big shifts in a woman's life. And so when you're, showing the uterus points and all that too, I'm thinking, yeah, we're right on the money there and the fallopian tubes and everything. So,
Yeah. From my perspective, we got the structure governs function. We get the tension patterns that are causing the body, whatever mentally or emotionally may be going on in conjunction with the birth of the baby, postpartum, that kind of stuff, or menopausal, change of life kind of things, both of them affect a person mentally and emotionally as well. So we hold ourselves differently based on those mind emotional things, which those tension patterns are going to constrict or restrict the flow of lymph in certain parts of the body. Now we work with those areas and free those areas up, balance the pelvis. So now the body is able to flush out the lymphatic system specifically in those areas. And then you couple it with the remedies that are going to be individual specific based on what they have going on, and then see where that gets us.
Yeah.